Today we are going to talk about liver. So I already written some point, the point we are going to discuss about. So first is location. So location is very important. Why? Because this is something we actually don't see it because we don't have cadaver, and some has cadaver, some don't have cadaver. For me, because I actually don't have cadaver, that's why I basically like the surface anatomy. So surface anatomy is very good to visualize those things. So as per the location, so let's try it first. Let me draw a diagram. So let's think it's like rough, okay? Don't judge my diagram. So this is our sternum, xiphoid process. Let's think about this is our costal margin, left and right costal margin, okay? And this is our, like, this is our iliac crest, and this is our anterior superior iliac spine, okay? You can visualize it, visualize it means you can palpate it. So put your two fingers above it. So basically, where is this iliac bone, right? Hip bones. The superior part, when you palpate it, superior part is the iliac crest. Now move your finger. So like visualize like this. So let's think about, this is our left side, okay? So this is the superior part. So in lateral view, like you will, if you stand like this, put your finger, and from lateral view, from lateral view, put your finger to the medial side, and here you will feel it. There is an protuberance, there is an outboard type of thing. So that will be our anterior superior iliac spine. And the interesting thing is that when you will go palpate a little further, you can feel this ligament. What is the ligament? Inguinal ligament. Yeah, that will be hard. When we will palpate, that will be hard, because in the upper portion, upper portion means like these are pubic symphysis, okay? So when you start palpating here, when your finger will be here, it will be a little bit of hardy type of texture. But when you will palpate this region, it will be soft. So you will understand, okay, there is our inguinal ligament. Got it, right? So yeah, so surface anatomy, right? So what is the liver? Now we know there is a quadrant, 9 quadrant region. Let's see, this is our clavicle, okay, mid-clavicular line. I'm not going to discuss about this one. Our main focus is how to evaluate the liver. So in this quadrant, we know liver occupies this is right, this is left. So right hypochondrous region. This is epigastric region, right hypochondrous region, epigastric region, and left hypochondrous region. Let's think about the terminologies. Like when we say right hypochondrous region, so right, right is what is right, right? Hypochondrous. What do you mean by chondrous? Chondrous means cartilage, right? Hypo means below the cartilage. So that our 6 is true. From 7, that is false. And 7, 8, 9, 10, these are all merged together in a single cartilage and joined to the sternum, right? So let's think about this. Think about this like this. This is our 7. For an instant, this is our 7. Okay. Now that 7, like say 8, 9, 10. So this do. So they all at this medial end, they will make what? Costal cartilage, right? So this costal cartilage will fuse with this 7, and they will go medially and attach with our sternal bodies. Clear, right? So where I was, right hypochondrous region, right hypochondrous region, right? So below the hypochondrous region, you got it. As well as left hypochondrous region, claro, easy. This one, epigastric region, like epigastric region. So like if you talk about this terminology, this is what umbilicus. Normally we say epigastric. No, gastric, right? Gastric. This is gastric. Above the gastric, epigastric. Below the gastric, hypogastric. They also have some alternative names, but for simplicity purpose, we just make it like this. So what is this? This is our terminologies. So how to visualize these things? Okay, so liver. So come here. Liver. So try to visualize. Okay, liver. Right side. Okay, liver. Liver. So this is our liver. Diagram is little bit of anatomically incorrect. Let me correct it. Okay, so liver occupies the right, left, and epigastric. The superior border. Okay, I will teach these borders, but just believe me. Superior border. What do you mean by superior border? The above border is very simple, right? Above border, superior border. What will be the superior border? Okay. Now, come on to the surface anatomy. There is our right nipple, left nipple, right nipple, left nipples. Below the right nipple, we got our what? Fifth rib. Memorize these things, because yeah, you have to memorize these things. The more you memorize, it will be easy. So the superior border of this right lobe will be in the fifth ribs. To visualize well, like come on, you have to count. You can count, but when we'll get in advanced stage, you will just point out, okay, I know below the right nipple there will be a fifth rib. Now the left part. So this is our left nipple. So left nipple below medially. So this is our medial side. This is our lateral side. So if this is the nipple, this is the medial side, this is the lateral side. Clear? So what is this? This is the left superior border. Now try to visualize with me. We know right, we know left. Okay, so what will be the middle? So because we have to make a line, right? Yeah, you can make a line with 2 points, but to be more accurate, make it 3 points. This is our sternal bodies. Huh? This is our body. This is our xiphoid process. What is this? Joint, right? So in this joint will be the superior surface of this middle part. So now you got the superior border. Like, let's think about this. Its superior border is very important because we got our diaphragm. But now inferior border, like I will not discuss with this, because in literature, in textbook, you will get, but I think personally this is variable according to the person. And so just remember the superior border. If you want, you can just text it, right? So this is the location of the liver. So normally you will get these 3 locations. If we go into the surface anatomy, the nipple concept will come there. So this is our roughly locations. Okay, so here we saw 5th rib. Here we got 5th intercostal space. Here we lost nipple. Okay, You got the point. You got the point. Now, what we got here? External features. So, what is external features? What do you mean by external features? Now, what you do, you cut yourself. I'm not just a joke, okay? You just cut yourself. You bring out your liver from the abdominal cavity. Now you are holding it. Now, whatever you can see in a gross appearance, those things are what? External features. Superficial. Okay? So, the first point is surface. How many surface we have? But the most important thing, how does the liver look like? We know that kidney looks like bean, we know hearts look like a closed face. So how does liver looks like? Okay. Okay, I just remember one point. You know, when I was talking about the superior border, according to the nipples, nipples is a very good point to identify many things. Let me tell you another one thing. We know heart, when we auscultate, there is a called apex beat. You know, apex beat. What is apex beat? So apex beat is a location where you can hear the maximum heart sound. Normally we have 4 locations. Just trust me, we will go through all this, but for right now just think about, there is 4 locations like here, here, here and here. Trust me. Now apex beat. So normally when you start auscultate, what is the first point you will auscultate? Apex beat. So what is the location of apex beat? You are not going to count ribs. You know it because I told you. When you go advanced, you just know it. Below the nipples. Below the nipples. So the stethoscope below the nipples. Try to found below the nipples region, and most probably it will in the lateral side. I already told you, medial, lateral side. So there you can found the apex beat. Like when you go to a doctor, if doctor auscultate you, when the doctor will put the stethoscope, like you can like think about it, like what is the position he is getting there. According to the nipples, with the reference to the nipples, it will be below the nipples. Okay. So surface from structure. You all know pyramids in Egyptian, pyramids. So like this is a pyramid for an instance. This is our pyramid. Okay. Rough structure. Now someone just kicked it. Now what will happen? It will fall down. This is the shape of the liver. So liver is what? Now let's go to the actual diagram. Now you got this point, right? There is a pyramid. I don't know, someone just kick it. It's fall down and boom. So let's try to organize these things in a. This is a 3D model in 2D. What is in 2D? 2D is triangle. You know it, right? How many surface a pyramid have? 1, 2, 3, 4, 5, 4 triangle. Take a 1 triangle. In triangle we know this is base, this is apex, roughly. Now this is. So now this is structure in 3. So like this is base, this is apex. Now try to visualize in your body how this is our right, this is our left. Okay. Now try stand it. We know the liver is here, is here. Now put your hand like this. This is the apex. I hope you can see my hand. Okay, so this is the apex. So apex in the left side, and the broad area or this surface is our right side. So base in the right side and apex in the left side. So what I want you to, how to like learn this anatomy, by feeling it in yourself. Okay, that's what I'm trying you to do it. Now you know how to organize yourself. So first organize yourself. Try to visualize the pyramid or the falling pyramid in your body. And now think. We have surfaces. So this upper part, now think about this upper part. The upper part, what will be there? What is upper? We know superior. Superior is upper. Claro. Now, think about this one. What is this? Anterior surface. You know? This is front. Now, the back one. So what is this? This is posterior. Posterior, try to visualize the vertebra, the back. So this is in the back side. Try to visualize. When I say anterior, you will think about your abs. You know, this is anterior. When I say posterior surface, think about your back, you know, back side. When I say superior, so come on, where is the superior? Superior. Let's talk about a little thing. I hope you guys already know, but even though let's for completeness purpose, this is our what? Diaphragm. So how is this section? This section is like you are standing. I just cut you down like this, coronal section, you know, like this, you know? So this is what you will see. Where is these organs? We know there is something like heart. In two side we got lungs, and this is right side, this is left side. So here we got our liver. So liver is, so what is in the superior part? Liver. What is in the superior part? Sorry, let me clear. What is in the superior with respect to liver? Diaphragm. What is superior with respect to liver? Diaphragm. Now, so what is superior? Diaphragm. So try to organize. When I say anterior, your biceps, not biceps. Packs, 6 packs, 8 packs. Right? So anterior, abdominal wall. Posterior. What is posterior? Back, vertebra, back. What is superior? Superior, thoracic cavity, superior diaphragm. Okay, let me tell about diaphragm. You all guys know. This is our thoracic cavity. This is our diaphragm. Sorry, this is our abdominal cavity. So thoracic cavity and abdominal cavity is separated by diaphragm. Claro. But we have another cavity known as pelvic cavity. Now tell me, abdominal cavity and pelvic cavity is separated by what? Peritoneum. Okay? Peritoneum. We will go there, but believe me, take it easy. Okay? So we know anterior, superior, posterior. Now we got our this part. Now, come on, don't tell it this is inferior surface. Nah, nah, nah. This is not inferior surface. Think about like this. I told you, try to visualize these things. What is below the liver? What is below the liver? Organs. Your intestines, your liver, your stomachs, everything there. So what we know those things, those are visceral organs. Visceral organs, visceral organs. So all these collectively are known as visceral organs. Just remember this. So what we will call them? Visceral surface.